So one of the most valuable things about the Parents and Residents Together with Adolescents program is that the residents really get to hear from the young person, him or herself, what it's like to have a chronic illness. What are the concerns they have in terms of meeting the challenges of adulthood, stepping into greater independence? What are the things they wish their doctors understood about their condition and their concerns? Because often their perspective is very different from what the doctor is focused on.
Part A, Parents and Residents Together for Adolescents, is a collaboration between Pacer Center and the University of Minnesota. The program connects pediatric residents with families of teens and young adults with disabilities and special health care needs. The pediatric residents meet families in their home and in the community. The focus is on transition, from pediatric care to adult care, from school to employment, and from dependence on parents to the supports the adolescents will need to reach their most independent potential.
In addition, parent input is invaluable. And there's a little irony in our culture where parents often think that adolescence is a time where they need to pull away and really let their adolescent run the show. And in some ways that is true, that adolescents need to develop skills of independence. But as a pediatrician and adolescent medicine specialist who's been practicing for over 25 years, I would say that the input of the parents is as valuable, if not more so, because they really see the whole picture in a way that the adolescent doesn't just yet.
The pediatric residents see firsthand the challenges that families face. 3 pediatric residents from the Part A program share their experiences.
This experience gave us the opportunity to see patients that we're used to taking care of in a medical setting and step into their lives, see their homes from a different perspective, really realize what it's like for them to live on a day-to-day level, much different than what it is to take care of their individual organ systems or to take care of their preventative health needs. Also to realize the type of struggles that they have accessing education, accessing housing, accessing different transportation services. All of that was a very good opportunity. That's something we don't typically see in the hospital.
I enjoyed seeing Trina's apartment and seeing how she lives and does day-to-day activities. She gave me an awesome tour of her place and showed me what is easy about living in her apartment and what is also a challenge. So it was an incredible experience and that I could not have learned in the clinic, that I definitely needed to go out in the community and see and learn for myself.
So I think one of the most important things that Spencer and his mom taught me about, Spencer has a very uncertain diagnosis, kind of an uncertain forward path. So just the fear and uncertainty associated with medical care in the future, how treatments are going to work, who's going to be a go-to for the family, and how to provide Spencer with a meaningful life while at the same time preserving the lives of his parents and his brother, is really important to think about and maybe something that we as doctors don't always get to approach or learn about.
No matter the details of the experience, the impact of the visits on the lives of these young physicians is enduring.
It takes me back to 25 years ago when I was a medical student and a resident and was part of the program that where I went and visited a family. I remember distinctly the 2 families that I met. This is 25 years ago. One of them I met in their home with their young adult, and we just talked about what life was like. And I can't tell you enough about what an impact it made on me in understanding the experience that families have in raising a young person with a disability. The second visit was actually one where I went to the to the young person's place of employment. So it was the YMCA in St. Paul, and I got to meet him there and to talk to his supervisor and see what an impact that this was having on his life and the life of the other people at the YMCA that were working with him, and it just made me realize that the goal that we should be pursuing as pediatricians really is about how do we create a system that allows and promotes the health of young people to the point where they are most engaged in their communities, and how that requires that we work closely with families and communities together so that we can all be doing that.
If you or someone you know is interested in the PART program, contact Pacer Center and ask to speak to the PART program coordinator.